With your slide clipped onto the stage, turn on the light source. For stain slides, you want to make sure that the condenser is raised all the way up, that the iris is all the way open, and that the light intensity knob is turned up. Please see the microscopy video for more detailed instructions on how to focus your microscope when looking at stained slides versus unstained slides. When looking at pre-stained slides, there is no need to wear gloves. You must wear gloves if you are handling specimen or if it is explicitly noted in the laboratory procedure. Begin using the 4x objective. Twist the coarse objective knob to bring the image into focus. You should see something similar to this when focusing using the 4x objective. Once the image is in focus, twist the 10x objective into place and focus the slide using the coarse adjustment knob. It should look something similar to this. While still under the 10x objective, move the slide to a thin area where the red blood cells are just touching and they are overlapping just a little bit. You want to move the slide more toward the feathered edge, and it should look something like this. Once you have found an acceptable area, turn the 40x objective into place. If you are in focus at 10x, you will not need to move the stage at all. The objective gets close to the slide, but it will not hit it. The 40x is the highest magnification you can use without oil. You will sometimes hear the 40x objective referred to as high dry. Use the fine adjustment knob to focus the image under 40x. You should see something like this. This area is a little too thick to perform our differential. Move the slide toward a thinner area and try to find an area that has 2 to 3 white blood cells in one field. Once you have found an area where the red blood cells are just touching and slightly overlapping, you have found the perfect area. Turn the nose piece so that it is halfway between the 40 and the 100x objective. Put the oil on the slide in the area directly above the light source. Put enough oil on the slide that a bubble forms. Be careful not to add too much oil. A little oil goes a long way, and you do not want to leave a mess for the next person who's going to use the microscope. Turn the nose piece so that the 100x objective clicks into place, taking care not to drag the 40x through the oil. Notice you will not have to move the stage. Use the fine focus knob to focus the image. Never use the coarse adjustment knob when you are using the 40 or 100x objectives. You may have to turn up the light. This is what the slide should look like using the 100x objective. Notice that the red blood cells are just barely touching and barely overlapping. Now move to one edge of the slide so that you can start counting white blood cells. You do not want to be too close to the edge, however. Monocytes and neutrophils tend to be pushed to the edges during the slide making process. This will give you an inaccurate count. After moving to the edge of the slide, you may have to re-identify a good area to begin your differential. Here's what it looks like when you are moving to the edge of the slide under the microscope. Again, make sure that you start in an area where the red blood cells are just barely touching and barely overlapping. You are now ready to begin counting and differentiating your white blood cells. This is a good area to begin counting. In this field, we see only red blood cells and platelets. There are no white blood cells in this field. Once you have counted the cells in one field, go on to the next microscopic field and continue your counting. When counting, move the slide as shown here. Notice that you start in the thinner area of the slide and move toward the thicker area of the slide. Also notice that Mona is constantly manipulating the fine adjustment knob as she looks at the slide. It's important to constantly use that knob to focus in and out. These cells are three-dimensional objects and they have depth, so you need to constantly adjust the focus so that you can see all the cellular characteristics. This is especially true when determining the presence of granules and for evaluating the characteristics of a cell's nucleus. Please note that this part of the recording was recorded for demonstration purposes only, and that in real life you would be examining this slide using the oil immersion lens, which is also called the 100x objective. Notice that Mona goes from one side of the slide to the other side of the slide. When she reaches the edge, she moves the slide one field horizontally toward the thicker edge of the slide and then begins moving it back in the other direction. She repeats this pattern until she has identified 100 white blood cells. It's important that you stick to this pattern so that you do not double count any white blood cells. This will ensure that you have an accurate count. This is what it looks like when you are following the pattern under the microscope. You can quickly move through fields that do not have any white blood cells. When you will come to a field that does have a white blood cell in it, stop, look closely, evaluate its characteristics, identify it, and record it using the differential cell counter. Here you can see Mona has found a segmented neutrophil. Now that we've identified it, we can record it on the cell counter. Continue to scan the slide from the place where you left off. Do not deviate from the pattern. This is a large lymphocyte as evidenced by its large round nucleus and round cytoplasm. It is larger than average, but it is a lymphocyte, and so Mona records it by pushing the lymphocyte button on the cell counter. Scanning the slide until you come upon your next cell. This is also a lymphocyte. It is an ideal-looking lymphocyte in that it has a round nucleus surrounded by scant cytoplasm. Mona records this lymphocyte by pushing the corresponding button on the cell counter. Continue scanning the slide until you come upon your next cell. This is a monocyte. It is a characteristic monocyte in that it does not have a round nucleus. The nucleus is almost kidney bean shaped. It has a large amount of cytoplasm. The cytoplasm has a gray-blue ground glass appearance, and it has vacuoles in it. Record the monocyte on your cell counter and keep going. As you can see, you can quickly scan through any field that does not have a white blood cell. This is a smushed lymphocyte. Count it on your cell counter and keep moving. Here is another segmented neutrophil. Count it, but also notice that the red blood cells are spread far apart. This means that you have reached the edge of the slide and that it is time to move your slide horizontally one field, and then you can begin to scan in the other direction. Here is another segmented neutrophil. Continue counting in this manner until 100 cells have been counted. Make sure that you follow the pattern so that you do not double count any cells. The cell counter will ding like this once you have reached 100 white blood cells. Record your results and then reset the cell counter as Mona is showing you here.